going to show you how to set up and use your Finetest auto-coding premium blood glucose monitoring system. I'll walk you through everything you need, just follow my lead. It's all divided into 2 sections, so if you need anything, you can always go back and watch that part again. Now, the first thing to do is to make sure you have everything you need to start testing. You should have the following items. 1. Finetest Premium Glucometer. 2. A container of Finetest strips. 3. A lancing device. 4. Lancet. For settings, long press the power button for 3 seconds to set the user activity. User ID option, date, time, test unit, temperature unit, a number of days for average result, and alarm. After each setting, press the power button once to confirm your settings, and it moves to the next option. Using your lancing device. I'm going to show you how to use the lancing device. First, you will need to load your lancing device. For this, you will need 1 lancet. Remove the cap of the lancing device now. Insert the lancet into the lancet holder as shown. Push it all the way in until it clicks in place. Then twist and remove the protective cap from the lancet to expose the needle. Place the cap back on your lancing device and be sure to align the notch of the cap with the mark as shown. The next step is to set the penetration depth to match the individual skin type by turning the dial on the cap. You can select the depth of the lancet. Set the dial to 2 to begin with. You may need to adjust the setting a couple of times until you find the right level for your skin type. Press the yellow button to release the lancet. This will lance your finger. This part is important. The lancets are disposable and should only be used one time. A reused lancet is no longer sterile and will lose its sharpness and will become painful each time you lance your finger. When disposing a lancet, always make sure that they cannot cause injury and always use sharp containers to dispose of the lancet. Remove the cap of the lancing device to remove the used lancet. Point the lancing device into the sharp container and eject the lancet by sliding the ejector forward as shown. Then place the cap back on the lancing device. Performing your blood glucose test. Now, you're ready to do a blood glucose test. First, you will need to choose a finger to take a blood sample from. It's best to alternate between fingers as they can become sensitive over time. Remember to always wash your hand with warm soapy water and dry them well before obtaining blood. Take the box of strip and open it carefully. Inside, you'll see some paper with technical information and a container of test strip. Take a test strip from the container and always remember to close the lid tightly. This helps protect the remaining strips. The strip has a green test area in the center and 2 small arrows showing you which end to insert. Insert the test strip into the meter. A small flashing blood drop symbol will appear on the screen. This tells you that the meter is ready to test. When lancing my finger, I always use the side of the finger rather than the tip as it's more comfortable and less sensitive. Now, prime the lancing device. Push the plunger all the way down. Press the pinhole opening on the lancing device cap firmly against the side of your finger and press the yellow release button. Massage the finger in the direction of the fingertip to help the blood drop form. Apply the blood to the center of the green test area on the strip. When enough blood has been applied, a small hourglass symbol will appear on the screen to show you that the meter is working. Your blood sugar reading will be ready in 9 seconds. It's just that easy. Now, you have your blood sugar reading. 2 important final steps. First, dispose of a used test strip. Then, always dispose of used lancet. When disposing a lancet, Always make sure that they cannot cause injury, and always use sharp container to dispose of the lancet. Remove the cap of the lancing device. To remove the used lancet, point the lancing device into the sharp container and eject the lancet by sliding the ejector forward as shown, or use the protective cap from the lancet, pressing the lancet against it, and eject the lancet. Then place the cap back on the lancing device. Now put everything into the carry case for the next time you need to test. You'll find more information in the user's manual that came with your meter. If you still have any questions, just go to www.codixpharma.com. Thank you for using the Finetest Premium AC Blood Glucose Meter.